Welcome to the course, Acupuncture and Myofascial Lines for the neck, upper back, and shoulders. This course is presented and written by myself, James Spears. So let's go ahead and take a look at the next page that reads Intro. And the first point here reads, learn about the various myofascial lines and why this is important for acupuncture point selections and pattern identification. So the myofascial lines were discovered and written about by Tom Myers in his book Anatomy Trains, and he's a structural therapist. So it's really interesting to compare these myofascial lines to the traditional meridians, and by understanding the anatomy of them and some of the other principles that Tom Myers speaks of in his book, such as Tensegrity, we can come to better understand point functions, point selections, and point combinations, as well as use the myofascial lines in our diagnostic skills, as well as in forming a diagnosis and doing pattern identification. So the second point here reads that we're going to cover some basics of alignment, structure, and posture. So I'm just going to review some very basic things because a lot of acupuncturists haven't been trained in structural conditions, and this is something that is really important for us to understand, especially when treating musculoskeletal conditions. And so we'll be reviewing some of the basics of that. And when you understand these myofascial lines and when you're familiar with the anatomy of it, I found that it's really the best way as an acupuncturist to come to understand structural conditions and then how to treat it as well. So this will be something that we speak of in this course. And then the third point here reads, become masters at using 3 to 6 point combinations. So I remember when I was a younger acupuncturist, I would hear these stories of doctors being able to just do a few needles, and I even studied in Beijing with a doctor who was known as Dr. One Needle, and I was really impressed at this time about how can someone just use so few needles and get great responses. And you hear about this in the Master Dong system as well. And when I was an early student of that, I didn't have that level of skill at that time to be able to use 3 to 6 needles. For some conditions, you can learn some of the Master Dong points, and just 3 needles will take you a long ways. And that was what led me into that system, was discovering how using 3 needles can have a very profound effect on people. But it took me years and years and years of study and research and clinical experience to really develop mastery at that. And now for many of my clients, I can use 3 to 6 needles. And I've been able to test this over a lot of years doing group acupuncture. I'm not doing group acupuncture any longer with COVID. However, before COVID, I was doing a lot of group acupuncture, and that was a form that really allowed me to get much better at using fewer needles. So we're going to be speaking about that. And then the next point here reads 2 levels of myofascial lines, superficial and deep. And then one strategy that we can use is to put 3 needles on a superficial myofascial level and then 3 needles on a deep level. So we'll see how that fits together as we move through the course. That's just one strategy. And so with these myofascial lines, then we'll find that there are the superficial levels of muscles and myofascia. And then there are myofascial lines that are at a deeper level. So understanding this and the anatomy of that is tremendously beneficial in better understanding acupuncture point functions, as well as how to combine them. The next point here reads traditional points, Master Dong's points, system 1 and 6, and moving beyond Tan's systems. So there's the traditional points that are used in TCM. Now we're going to be comparing those to Master Dong's points, because whatever system you're using right now, you're all probably familiar with the traditional points. The Master Dong points may be new to some of you. So by comparing these two point systems, we're going to find that there's a lot of overlap, and in comparing and contrasting them, we can also gain insights into each system. So I think that that's really beneficial. And even if you've been doing Master Dong's points for a lot of years, like revisiting the traditional points and comparing and contrasting them can be very beneficial to help you understand some of the finer nuances of the system. And then System 1 and System 6, I don't want to spend a lot of time on the systems of Dr. Tan in this. Many of you are already familiar with that, and that's a sort of a basic level, and this course is more of an advanced level, and so I don't want to spend too much time on Tan's systems. There's plenty of resources out there if this isn't something that you're familiar with, and for this course it's not necessary to know all the systems or to have mastered them. We're primarily going to be speaking about the System 1 and System 6 connections, and ultimately through better understanding the myofascial lines and how this fits in with the traditional points and Master Dong's points and how it fits in with Tan's systems, we can move beyond those systems. We can transcend those systems. I use those systems as my primary form of practice for a lot of years, and I highly recommend that any acupuncturist master those systems because they're tremendously powerful. And at the same time, when I learned about these myofascial lines, it allowed me to transcend those, and so I'm not so confined by that method of pattern identification. So, you'll find that if you're just doing Zong Fu pattern identification now, and you've learned Tan systems, like that took you to a whole new level. So the way I like to approach this is to learn the system thoroughly, and then transcend it and integrate it and transcend, integrate it and transcend. And we can do the same with these myofascial lines once you get really proficient at that. So I do want to keep the focus more on these myofascial lines and how it relates to Dong's points, but we will be discussing the System 1 and System 6 connections. For those of you that are new to this, the System 1 connections are defined by the traditional names of the meridians, such as this one here. If we look at this, now this is the superficial back line, which looks a lot like the urinary bladder meridian, but the urinary bladder meridian is also known as the foot Tai Yang meridian, and then there's a hand Tai Yang meridian, which is the small intestine meridian. So the System 1 connection has to do with the traditional meridian names, the Tai Yang meridians, the Xiaoyang meridians, the Yangming connection, and then there's the Tai Yin and the Xiaoyin and the Juiyin. So when we speak of the Juiyin, that's the liver pericardium connection. The Xiaoyin is the heart and kidney connection. The Tai Yin is the lung spleen connection. And the Tai Yang is the small intestine urinary bladder relationship. The Xiaoyang is the Sanjiao gallbladder relationship. And then the Yangming is the large intestine stomach relationship. So that's the System 1 relationship. And then the System 6 connection is when you use points on a meridian that has pain or symptoms. So for instance, if a client has pain in their neck, in the urinary bladder meridian, or in the upper back, or in the low back, if there's pain along this meridian, the foot Tai Yang meridian, we can use points on the same meridian or on the same fascial line, and we'll do that on the same side. Whereas when we do a System 1 needling method, if I'm treating pain on the left side of the neck in the urinary bladder meridian, then I'll use points on the hand Tai Yang meridian on the opposite side. So most of you are probably familiar with this already. We are going to be speaking about it to some degree, but there's also the assumption that most of you already have that information. So we'll be reviewing some of that and speaking about how that relates to these myofascial lines. The next point here that relates to this is contralateral needling, ipsilateral needling, bilateral needling, and distal needling. So when we do a System 1 method of needling, then we needle on the opposite side. And then if we're doing a System 6 method of needling and we're needling the symptomatic meridian, then we needle on the same side, on the ipsilateral side. The bilateral needling is widely used in TCM. Bilateral needling is when you use the same points on the same side. So for instance, if I need a lung 7 lung 7 may not be the best example because we'll often do lung 7 with kidney 6 contralateral to each other. So there are some systems and people, though, that will use lung 7 on both sides of the body. So, for instance, bilateral needling is when you use lung 7 on both sides, or that could be any point. You could needle PC6 on both sides, or lung 6 on both sides, or Sanjiao 3 on both sides. Whenever you do the same points on both sides, that's bilateral needling. And one thing that I want to mention here is that some research has indicated that there's no additional benefits from bilateral needling, and that by needling only on one side is sufficient. This comes from some research on cardiovascular conditions, and they found that just putting the points in on one side is as beneficial as bilateral needling. Now, in the Master Dong system, we will most often use different points on different sides in the Master Dong and system and the balance method. So think about it this way, if this is something that's new to you, okay? When you put a point in, then it's going to stimulate a certain meridian or meridians, and it's going to stimulate a myofascial line as well as certain nerves. So why would you want to do the same points on both sides? Because you're just going to be stimulating the same meridians and the same nerves and the same myofascial lines. So by doing different points on different sides, such as here in the hands, then you're going to be able to reach more levels, more energetic levels, more neurological levels, and more myofascial levels as well. So you're able to do a lot more with fewer needles. And this is one of the keys to using fewer needles, is doing different points on different sides of the body. Now, distal needling, you should be familiar with this. Distal needling is when you needle points that are far away from the area of pain. So in TCM and in medical acupuncture and trigger point therapy, they put the needles in locally. So if you've got pain here in the upper back and shoulder and you put points in there, then that's a form of local needling. But distal needling, we wouldn't do the points here. We would probably start with points on the opposite side, down on the leg or on the opposite hand, and that's a form of distal needling. Now, one thing that I want to say about this is that that's also a form of contralateral needling when you needle the opposite side. And there has been research done that shows that needling on the opposite side is beneficial, because let's say someone has shoulder pain here in the left shoulder, and then let's think about this in terms of the nerves, because that's the way the research is typically orientated, is looking at the nerve responses. So the nerves that innervate the deltoid will go into the spine, but then you've also got that happening on this side. So if you do points on this side, then it's going to stimulate those nerves at the same level, at the same nerve root area, and then that can have a beneficial effect on the opposite side. This is something that's been confirmed by medical research, is that contralateral needling on the opposite side is effective because it is able to produce neurological responses at the same spinal level. Okay, there's a lot more that could be said about that, but I'm going to leave it there for now. Just know that needling on the opposite side is an effective method of treatment that's been confirmed by research, and it's also something that they use extensively in the Master Dong system. We're also going to be speaking about treatment strategies, and one strategy that I really like is to start with the more distal points. So the points that are most distal in the body, such as on the feet or on the hands. These points are very sensitive and very effective, and they work very quickly. So I like to start with the most quick working points generally that produce the strongest neurological and myofascial responses, and then move proximally as needed. And I've put them back to the fingers here. So we're going to be speaking about some of the finger points. I've never spoke about finger points in my other two classes. So I'm going to introduce some of the finger points for neck and shoulder and spinal conditions here, because there is some insight to be gained from that. And I'd like to save the finger points typically more towards the end of the session. It's very, very rare that I'll ever start with finger points because you just don't get the same response that you do when you needle the hands and the feet. We're going to speak about some of the details more in this. And then the next point reads acute and chronic, short and long-term strategies. So it's really important to understand the differences between acute and chronic conditions. If it's an acute condition, you got to have a short-term strategy because you don't need to see the patient in the long term. And if it's a acute condition that they haven't had very long, then you're going to want to get fast and effective results for them. If it's a chronic condition, then we need to think more about long-term strategies. So we'll talk about that and how that relates to these different levels as well. Typically, I like to start at the superficial levels and then move deeper as needed because this gives me extra diagnostic information as well. So say you have a client and they've got neck and shoulder pain, and maybe you're really not sure what it is. They don't have any x-rays or MRIs, or it's not clear at what level this exists at. So if you start with points that work on the superficial levels, then you can clear that level out. You can know that you worked on it, and if you get a great response, that's what we want. Excellent. Then if you don't get a good response, then you can develop the system of moving to using points that work at a deeper level and then see what response you get. And that alone is worth the time invested in this course, is because once you get clear on the anatomy of these superficial levels and the deeper levels, and you start to develop point protocols and prescriptions based on that, you're going to get a lot of extra diagnostic information, and you're going to know how to better proceed when your client doesn't respond to your first group of points. And the next point here reads primary, secondary, and tertiary points in the four limbs. So there are primary points that I'll always typically like 80 or 90% of the time start with when I'm treating the neck, back, and shoulder. The primary points are the ones that produce the fastest and quickest and most effective results. Dr. Tan taught a point prescription in the hands, which is Lingu and Da Bai 22.04 and 22.05, which is essentially Li3 and a point very near Li4, as well as Shabai 22.07, which is very near San Jiao 3. So he taught that that was effective for 80% of cases for low back pain, and I tested that for a lot of years, and sure enough, that is a very effective point combination that works for a lot of lumbar pain, but you will encounter cases where it just doesn't work, and that has to do with the different levels that these different points work on. So understanding that that point combination works on a more superficial level, if you don't get a response with those 3 points, then you know that you should move to a deeper level. You're probably thinking in terms of meridians, and if you're using Tan systems and you're basing it on that, that's great. It's a wonderful system. However, by understanding the myofascial lines and the different levels there, then that's going to give you additional information about how to proceed. There's secondary points they can be highly effective as well, but I just often choose not to use some points to begin with for various reasons. There's tertiary points, which are points that I don't often use, or they're like a third level of points that you'd use, and then the four limbs. And what I mean by this is that in the balance method and in the Master Dong system, as well as other systems too, we'll needle different points on different sides. I've seen this in 5 elements. Some 5-element forms will do bilateral needling. Other 5 elements may do different points and different sides, and then they'll do this with medical acupuncture as well. So, but typically what I do and what I found to be most effective is to do different points in each of the limbs, and then that way you're stimulating the most number of meridians, the most number of myofascial lines, and the most number of nerves. And that allows you then to approach everything from numerous angles and not just have a more one-dimensional form of approaching things. Okay, let's take a look at the next page here that reads Tensegrity. And if you've taken some of my other courses, you've seen a slide that's familiar to this. I've added some new points here, and this is a really important thing for us to understand when treating musculoskeletal conditions and even internal conditions as well. Because tensegrity is really the study of how tension moves through the system and how the integrity of a system is maintained through tension and how the tension relates to holding the structure together as well as how it relates to functionality. So just a few key points here then. The word tensegrity includes tension and integrity, and it describes systems of compressed parts in a net of tension and how tension moves through a system. So in the human body then, the compressed parts can be the muscles that are surrounded by the fascia, and the muscles are involved with the movement, but they will hold tension, and then the fascia can hold tension as well. And this plays both structural and functional roles in the body. However, things go wrong, and we can hold tension in the body in various ways. And so as we understand this concept, then it can also help us to better understand how acupuncture works and how we can use distal points, and even why distal points are often more effective than local points. So let's just continue to read what it says here. It says, tension moves through fascia, and distal needling is highly effective for many disorders. So through the principles of tensegrity, we can come to understand why we can use points on the ankles to treat the neck, and why we can use points down in the legs to treat various areas in the upper part of the body and in the shoulders. So we'll be discussing some of these principles as we move on. And our job is to find where the tension is being held and how to best release it. Now, when clients come to us, and they'll often use the word tension, they might say, yeah, I'm holding my stress and tension in my neck and shoulders. Well, one form of needling is local needling and needling directly into those areas of tension, but there's several reasons why we don't want to do local needling. Local needling can be made worse with certain conditions. It can also be more invasive. So for instance, the points GB20 and 21, needling those points carries some risk, and it's more invasive than needling points on the hands and the feet. And so our job is to find where the tension is being held, but then how to best release it. And it's often best to use distal points because they're safer and they tend to work faster and more effective. And the more that we can understand how tension moves through the meridians and through the myofascial lines, then it helps to put a lot in context. Now, the next point here reads, fascia connect the interior and exterior and play structural and functional roles. We've discussed that. But I've mentioned this before in my other courses, but I want to go over this again because in traditional meridian theory, we have this idea of the external internal relationships of the meridians to the organs and with other meridians. And we can now start to validate these traditional theories and concepts through the anatomy of the myofascial lines, as well as looking at how the internal fascia and the visceral fascia connect to other structures. So I have a whole class on internal medicine where we go into the visceral fascial connections and how that relates to the internal external relationships, but I just want to mention that quickly here. And then the last sentence reads, internally the fascial connections relate to the internal external meridian theories and Ton's systems. So even Dr. Ton's 6 systems can be understood in terms of the visceral fascia and these connections that exist. The last point here reads, Dr. Helen Lange's research has shown that acupuncture stretches fascia when grasp and twirling occur. You've probably heard me speak about this before if you've watched some of my other lectures. Her research has found that when you spin the needle and when you twirl it, or when you get the grasp, when the skin comes up on the needle, then that's stretching the fascia. So Important thing to consider, because that shows that you're getting a good needle response. Like, even as an early practitioner, when I first came out of school, I think I first realized that the points that I did where the skin raised up, they seemed to be the ones that got the clients the best results and were the most sensitive. And when that grasp does happen, there's actually a stretch that's going on there. And this is important to understand in terms of the mechanical ways in which acupuncture works and how that relates to a number of other things like biomechanics and structure and function and all of these things. But let's go ahead and look at what I wrote above these pictures. And it reads contraction and strain, concentric and eccentric contractions. So when muscles contract, then they shorten, and that's a concentric contraction. But when muscles lengthen, that's a eccentric contraction. And often when muscles get stretched too much, you'll get a lot of injuries that are caused by too much strain or too much stress, too much pulling in the muscles. So as you move through this course, I want you to consider that if you're trained in Western biomedicine, or if you're a physical therapist, then this is something you've probably learned a lot about. But as acupuncturists, we don't tend to think like this in terms of concentric and eccentric contractions. But I think it is something important to consider, and it relates to our needling methods, and it relates to biomechanics. And there's also been some research, and if you watch your musculoskeletal conditions, when people pull their muscles or strain their muscles, that's not due to a shortening in the muscle. It's often due to a strain or a excessive eccentric contraction that pulls the muscle, and then a person gets injured. So important things to consider as you do your point selections, and we'll discuss some of this as we move on. And then the last point here reads, where does tension, contraction, and strain get held in each client? We want to be asking ourselves about this. And I bring this up because I think that, like, even with some of the biomedicine people out there, and anyone that's doing like trigger point therapy or thinking in terms of trigger points, we often think in terms of muscle contractions, and a trigger point is an area where there's like a miniature muscle contraction going on. But it's, I think, less common, especially for acupuncturists, to think of injuries and pain as a overstretch or a eccentric contraction. And when we start to look at these myofascial lines and consider the structure and alignment, we'll find that a lot of pain conditions arise from too much stretch and strain in certain areas, whereas that area that's contracted is less likely to have pain. And then this can help to influence our point decisions as well. So we'll be discussing some of these things as we move deeper into the course. Where does tension, contraction, and strain get held in each client? So our clients will tell us that. They'll say, oh, I'm holding my tension in my shoulders. And we find that's GB21, and that's great, and that's where we can begin. But the more that we understand the principles of tensegrity and concentric and eccentric contractions, then we can get better at determining what group of 3 to 6 needles will best release it. So let's go ahead and move on to the next section, where we talk a little bit more about tension here. So many of you are probably familiar with the resistance bands. We see them here. A lot of people are using them in their workouts, and they're a helpful thing to reflect on as we move through this and we think about the principles of tensegrity and we think about the myofascial lines. And let's begin by talking about the different types of bands. So you've probably seen like the small thick bands, and there's large thick bands too, but I want to just begin by speaking about small thick bands, and they would be very difficult to pull apart. Whereas you can have a long thin band, and that would be very easy to pull apart. Well, there's some relationship here then with the distal points, and I've written distal needling here. And it's useful to think of the points between the hands and the feet, so the muscles between the metacarpals and the metatarsals. These are like small, thick bands. And so they're able to hold a lot of tension. Whereas the large, thin bands, like if you compare the fascia that surround the quadriceps, we've got a lot of muscle and then a thin layer of fascia surrounding it. But if you go down to the Achilles tendon, then we've got very dense connective tissue. And the points in the Achilles tendon are very good for neck pain. And I think this has something to do with the density of connective tissue there. So this next point reads connective tissue density, the Achilles tendon, head of the fibula, lung 7, muscles between the metacarpals and metatarsals. So these are all areas where there's a lot of connective tissue density, and this is where we find some of the strongest points for treating the neck and the upper back and the shoulders and the back and spine as well, is in these areas where there's a lot of connective tissue density. So this lends support to the idea of the myofascial lines being a very substantial factor in understanding how acupuncture works. And we'll be discussing these points in more detail as we move on. But I want you to start thinking of these points between the metacarpals and the metatarsals like the small, thick bands, and then the areas like the quadriceps and the more proximal points are like the large, thin bands that are easier to stretch. But there's differences in the tension that they're able to hold. Now, this also relates to biomechanics and basic physical forces as well. And we're not going to speak too much about that because it gets complicated. But I want to keep this more focused on clinical expertise and what produces the clinical responses. But if this is stuff that interests you, then I would encourage you to explore this, because I think there's a lot of answers that can be found within biomechanics and thinking in terms of the raw physical equations and the physics of tension that relates to this as well. So this next point reads, fascia surrounding small muscle is more dense than in larger muscles per volume and surface area. Tendons are very dense connective tissues, and the interossei muscles and fascia are supported by bones as well. So because the bones are close together in the hands and the feet, that's probably helping these myofascial lines in that area in providing a stronger response in being able to support tension. So as these myofascial lines converge around the wrists and the hands and the feet and the ankles, you've got to have a strong support system there, and the bones are doing that as well. And this is important to consider because we do find that for conditions of the bones and arthritis and situations where there's bone spurs or disc degeneration, that there are certain techniques and points that we want to use that can be beneficial. And we don't want to forget about the bones as we reflect on some of this. Now, the next point here reads patient constitution. So as you're treating your clients, and right from the very beginning when I'm first doing my intake with clients, I'm asking myself, is this going to be a reactive, sensitive person that responds quickly, or are they going to be more of a slow responder? And this can help to determine what points you should use. So if you're working with someone that's highly needle sensitive, don't be needling the points 22.01 and 22.02 to begin, like in your first session. That's a good way to lose a client if you've got someone that's really needle sensitive and you use the most sensitive reactive points to begin with. They don't need that strong stimulation. You can use more proximal points, or you can use points that aren't so sensitive. But for people who are more slow to respond, then you're going to want to use more stronger points. You're going to want to use those points that are more sensitive because they need that extra stimulation. And one way to determine this is simply by their body size and their body type. So generally speaking, and this follows like an 80-20 principle too, Where the thinner type, people who have smaller bodies, or if they're more emotionally reactive or more emotionally sensitive, or if they are sensitive in some way, you can do some tests to determine this, and as you do your intake, be determining their overall sensitivity level, both physically and emotionally, because people who are physically and emotionally sensitive will tend to respond more quickly to needles, but then people who have larger body types, they tend to be more of the slow responders. So for bigger people, I want to use more intensive points, often from the beginning, or even more needles. And for the reactive type, you can use fewer needles. Okay, the next point here reads, myofascial lines converge in the neck, head, shoulders, wrists, and ankles. Now, this is an important thing to understand, and let's read the next point too. It says, neuromuscular convergence in the wrist, hands, ankles, and feet likely plays a role in the effectiveness of distal needling. So we're going to be talking a lot about distal needling in this course because it tends to produce quicker, faster, more effective results than needling locally or doing trigger point therapy. So if you're needling directly into the areas of pain in the neck, let's look at this next slide here. So common areas where people will get pain and tension are like UB10 and GB20 here on the occipital ridge, and then GB21. But the problem with these points is that it's quite invasive and it carries a higher risk than needling points on the hands. And these points on the hands can produce just as a good or even more effective results than needling locally. So we're going to be speaking about the use of distal needling, and a very important system to know about. Now, this myofascial line convergence in the neck, head, shoulders, wrists, and ankles, and the neuromuscular convergence that happens here as well. So what I mean by that is if we look at these myofascial lines, we can see that they have terminal points in the hands and the feet, and then also in the neck area. So here we see the back arm lines. This is known as the superficial back arm line, and then this is the deep back arm line. So we see our two levels that we spoke about are here, but then they begin and end in the neck and the hands. And then we also see this for the front arm lines as well, but these will terminate in different areas. Now, notice that the superficial front arm line here, it connects to the lats. So this muscle back here you see is the latissimus dorsi, and then this is the deep front arm line. And it includes the thenar muscles, and we've got some really strong points there that are good for treating the neck and the upper back area. But because those are such sensitive points, we don't want to use those for the first treatment with super sensitive and reactive types because it's just too strong for them. Now, let's take a look at this next page here, and we can see again how these myofascial lines converge and terminate in the area of the neck. So we see this superficial back line. It includes a lot of the small neck muscles, and then down here it includes the Achilles tendon. So there's that group of points, 77.01 through 77.04, the Achilles tendon points. They're located actually in the Achilles tendon, and they're known for treating whiplash and various other types of neck conditions. And then in the superficial front line, we see it includes the SCM, and then we've got points down here that can be used for, primarily we use points on the superficial front line down on the lower leg to treat the anterior and lateral shoulder, but we can see that this line converges here on the SCM and then the clavicle attachment. And then the lateral line here, we see that the same thing. We've got the myofascial line converging and beginning and terminating in the neck and then down at the ankle and feet. So let's go back to that. So this neuromuscular convergence in the wrist, hands, ankles, and feet likely plays a role in the effectiveness of distal needling, and as well as to imaging as we use in the balance method and in Masterdong style system. So if you're not familiar with imaging, then let's take a closer look at that.